To understand health record documentation, it is also important to understand how it is gathered and used. Different type settings gather and collect different types of information for patient medical records. The first half of this presentation will cover the different types of ambulatory care facilities, and the second half will cover the types of documentation collected in these type facilities. Ambulatory care is the care received by a patient that does not require or involve an overnight stay in a hospital. It can also be called outpatient care. The physician's office is the most prevalent location for outpatient services. Examples of the different types of ambulatory care are listed on this slide. Most ambulatory care facilities are privately owned by the clinician or a group of clinicians. They also include school clinics, urgent care centers, and public health departments. Ambulatory care emphasizes preventive care. It is also more convenient for patients to visit them since they are not staying overnight. Some surgeries and procedures are done via ambulatory care because they do not require a stay in a hospital. Recovery time is often shorter as well. Now let's discuss each type of ambulatory care facility in detail. ASCs are ambulatory surgery centers. It is estimated that 70% of all surgeries are performed on an outpatient basis. These type procedures are normally what we call same-day procedures because the patient is in and out in the same day. Patients arrive on the day of the procedure, undergo surgery in an operating room, and recover under the care of the nursing staff. No overnight hospital stay is required. Care is provided in either a freestanding or hospital-based facility. Most of your medical specialties utilize ambulatory surgery centers, such as orthopedic physicians and ophthalmologists. There are also accreditation agencies that accredit ambulatory care facilities. The Association of Academic Health Centers and the American Association for the Accreditation of Ambulatory Surgery Facilities, Incorporated. An estimated 80% of newly diagnosed cancer patients seek treatment in a cancer treatment center. These centers provide comprehensive treatment services to patients. They offer either radiation, chemotherapy, or a combination of both to patients. They have oncologists on staff that meet with patients. Centers even provide laboratory services, patient education, and access to support groups. This is what is referred to as a multidisciplinary approach. All services are provided under one roof for patients, minus any actual surgery that is performed. There are also centers that participate in clinical trials for new cancer drugs that are becoming available. There are standards for cancer treatment centers provided by the Commission on Cancer, established by the American College of Surgeons. Treatment centers can also choose to become accredited as well. That process is voluntary, as with other accreditation that can be earned facility. Community health centers provide care to economically disadvantaged individuals. They are operated by public health departments and local communities. The treatment provided is family-centered since illnesses may result directly from socioeconomic factors. All types of services can be provided in this type setting to include urgent care and preventive care. Some even operate dental clinics to provide dental services to patients. Since these patients typically cannot afford medical services, they pay on a sliding payment scale and may only require a small copayment for services. Healthcare must also be provided to those that are in our nation's jails and prisons. Upon entering confinement, a prisoner is given a general health screening. No consent is required since they are wards of the state. After the initial screening, they will be treated on an as-needed basis. If it is medically necessary to treat them, they will receive treatment while in confinement. There are even times an inmate will require surgery. If this occurs, they are brought into a facility to have surgery under the watchful eye of a sheriff's deputy while in the hospital. The National Commission on Correctional Health Care is the organization that sets the national standards for quality of care in a correctional setting. An imaging center is a freestanding facility that provides radiologic and other imaging services such as MRIs, CTs, and PET scans to ambulatory patients. Mammograms are the most frequently used service in an imaging center. Imaging centers can become accredited by the American College of Radiology. Industrial health clinics can be located within a business setting like a factory, or can be as a separate clinic. They emphasize employee health and safety. They will treat workers injured on the job or that contract illnesses on the job. They are also involved in workers' compensation, providing documentation as to how an injury occurred and how it was treated. They also release employees that have been out of work due to illness or injury. New employees will also visit an industrial health clinic to receive a pre-employment physical exam if required. They can also take any required drug and alcohol tests through the industrial health clinic. Student health centers provide care to full and part-time students who become ill or injured. Services include those that would affect the needs of a college student: allergy injections, contraception and counseling, health education, immunizations, HIV testing, lab services, primary care, routine medications, preventive medicine, smoking cessation, screening for sexually transmitted diseases, and women's health care. They also can provide emotional support for students by having them visit with a counselor or referring them to one in the community. The Family Education Rights and Privacy Act, or FERPA, F-E-R-P-A, protects students' rights in regards to their school records. The HIPAA law protects students' school health and medical record information. Urgent care centers are in most areas. They are walk-in clinics where you can go for evaluation and treatment. You normally do not need an appointment and sometimes do not need insurance. They can bill your insurance company if you have insurance, but they also take payments with non-insurance. This is where individuals can go when they are not severe enough to need emergency room services, but they still need to be seen for a medical condition. Urgent care centers are staffed by physicians or physician assistants or nurse practitioners. They are open after hours and on weekends, as opposed to a physician's office that closes at 5 p.m. during the weekday. Physician offices are also not open on weekends. If medication is required, urgent care centers can write prescriptions for patients so they can be filled at a local pharmacy after hours. Now let's discuss the content and format of medical records in an ambulatory setting. You will notice the documentation is pretty similar to that in a hospital setting. There are a few key items that need to be documented in ambulatory medical records that will be discussed in the upcoming slides. Complete and accurate documentation is critical in ambulatory medical records. The content and format help to plan and manage care of the patient. Services provided must be adequate and appropriate for the level of care received. Any claim submitted must have documentation to back up that claim if requested by the insurance company. Of course, the saying still applies: if it was not documented, it was not done. To protect the legal interest of the ambulatory service center, everything done must be documented as appropriate. Just as a medical record in an inpatient setting, an ambulatory record is used as a communication tool for other providers. The required elements or components for an ambulatory record are listed on this slide. You will see some similarities with hospital inpatient charts. Items not likely present in an inpatient chart include a problem list and an immunization record. Instead of a problem list, an inpatient chart would have a history and physical that captures this information. Immunizations are important to track in the event the patient is due for an immunization. This is especially important for pediatric patients. There are some recommended items that should be captured in an ambulatory setting. Patient instructions is one of those items. Patients need to have written instructions on how to care for themselves at home. They also need information on what newly prescribed medications may be for and how they are taken. Failed or missed appointments need to be documented as well. This helps the ambulatory center not be liable in the event patients miss and do not show for appointments. Flow sheets show the progression of treatment for a patient. Telephone contacts are also good information to capture. A patient may need to be contacted for various reasons when they are not at the ambulatory center. Now let's briefly discuss each item in detail. The registration record is where all of the demographic information is captured on a patient. This includes items such as name, date of birth, social security number, address, phone number, employer information, type of insurance, etc. The Uniform Ambulatory Care Data Set provides guidance as to the data fields and data sets that should be used to capture this information. The problem or summary list is a single-page summary on a patient. It is a quick reference sheet that can be used to review a patient's history. Items on this summary are previous surgeries, any complications from those surgeries, major medical problems, medications used to treat those problems, current and old conditions that may not be treated, and dates of last sicknesses and if they have been resolved. A medication list is required to be maintained in each patient record of an ambulatory center. In fact, many accreditation organizations require this information. Most importantly, the patient's allergies must be listed on the medication list. For each medication, the drug name, current dosage, instructions, and start and stop dates must be documented for each drug. Both a patient history questionnaire and a medical history are recorded in the medical record. The patient history questionnaire is completed annually or every few years. This is a form that allows the patient to update their personal medical information. The medical history is completed each visit. Its content items are listed on the slide. The chief complaint or reason for visit, present illness, and review of systems helps the ambulatory center and physicians to determine how to best treat that patient. Progress notes are recorded for every visit and encounter. They can either be handwritten or dictated. They list the diagnosis or diagnoses of the patient with the treatment plan or medications given. They can be structured, such as in the SOAP format as described in a previous presentation, or they can be in narrative form. Physician orders are kept on an ambulatory chart just as in the inpatient hospital setting. They must be signed, dated, and timed. Accreditation organizations require them to be completed in this manner. Patient instructions are also required for the ambulatory record. They should be given verbally to the patient before they are discharged or sent home. That gives the patient an opportunity to ask questions if they have any. Written instructions are given to the patient so they can refer to them once they are home. It can be difficult to remember all instructions given upon discharge, especially if the patient had surgery and is still groggy due to anesthesia. Ambulatory staff needs to document who the instructions were given to and at what time. Follow-up care and appointment information should be given in the patient instructions. They need to know when their next appointment is or if they need to call for their next appointment. A copy of the patient instructions that are given to the patient needs to be placed in the medical record. As mentioned on this slide, appointment no-shows need to be kept to show patient compliance with scheduled appointments. Also, each time an attempt was made to contact a patient, that needs to be recorded as well. Flow sheets are used for various purposes, such as displaying medical information from episode to episode. Examples are blood sugar readings for diabetic patients and heights and weights for pediatric patients. They can also document health maintenance activities. All telephone calls also need to be documented in an ambulatory record. These include calls made to patients and return phone calls to patients. The date, time, and phone number called needs to be included in this documentation. And of course, the staff member who placed the call needs to sign the document as well, either with a handwritten signature if in paper form, or electronically if in an EHR. Just like a hospital, there are various organizations that accredit ambulatory service centers. They all provide standards that help to measure and monitor the quality and effectiveness of care and the safety of their patients. This last slide mentions how regulations and policies, as well as risk management, can influence an ambulatory center. There are still state and federal guidelines that need to be followed even for an ambulatory center. They need to address the areas listed in their own policies and procedures. Just as any other type facility, they also need to verify their clinicians are licensed and certified to practice in their respective fields. They also need to have processes that check equipment to be certain it is working safely and properly. That concludes this presentation on ambulatory service centers.